Joining us now virtually in our newsroom, we have Dr. David Seidman, the Senior Medical Director at Avadel Pharmaceuticals. He is here to talk about something we might be struggling with, sleep. So welcome.
Hi, thank you, Mary. Thank you for having me. I appreciate the opportunity to speak with your audience. It's timely as this week is World Narcolepsy Day.
And so let's just jump right to it. So data suggests, or data came out that says Indiana ranks 4th in the US for having the most people with narcolepsy, with, gosh, over 5,000 cases. But there's also evidence that there might be some COVID-19 induced insomnia. First, can you explain narcolepsy and the difference between COVID-19 induced insomnia?
Sure. Well, they're really two completely different sleep disorders, but there can be some overlap, as I'll explain, in that COVID insomnia, which it's been termed, may actually affect how a narcoleptic is functioning. So narcolepsy is a rare neurological disorder, prevalence rates of about 25 for every 100,000 people, but as you mentioned, those rates are somewhat higher in Indiana and Ohio and some of the surrounds. But as I said, it's a neurological disorder that essentially manifests with two major symptoms. One being excessive, overwhelming sleepiness during the day. And number two, a symptom called cataplexy, in which patients may experience muscle weakness, either affecting the entire body or just parts of the body. And that's usually in the setting of some kind of strong emotional stimulus like laughter or crying. And it's thought to be probably an autoimmune disorder, meaning that the body's own immune system is actually attacking, if you will, parts of the brain that are responsible for producing a certain chemical that helps keep us awake. So if the body is reducing this wake-promoting chemical, sleepiness results. Now, COVID-somnia, as it's been termed, is really sort of a myriad of disorders, and it can affect not only those infected by the COVID-19 virus, but also those that have not been affected. So for example, you can, of course, most of us have experienced this, you know, we're all working from home. Schedules have changed. We tend to get up, for example, later in the morning. We go to sleep later at night. We may be napping during the day, which we never did before. So these sorts of behaviors can affect our internal circadian rhythms, for example, and may affect our ability to sleep at night. And of course, we're all experiencing fears and anxieties about getting contracting the virus. We have fears and anxieties about losing our job. So all of these things affect our ability to get a good night's sleep. And as I mentioned earlier, certainly people with narcolepsy are no less susceptible to those kinds of COVID-somnia type of symptoms.
Is there a specific population that's more vulnerable to, let's say, narcolepsy?
Not necessarily narcolepsy so much, other than the fact that certain people may have an underlying genetic predisposition to that immune process that can occur with narcolepsy. So they may have those underlying genetics. In terms of COVID-somnia, really anyone's susceptible to that potential problem. In general, women tend to have more insomnia than men, and that certainly may carry over into COVID-somnia as well. But certainly anyone, we all have those same anxieties and fears, so that may not differentiate.
And what are the signs and symptoms of narcolepsy, and are they different than COVID-somnia?
Well, narcolepsy, as I said, is essentially, there are essentially two main features of that disorder. One in which there is significant sleepiness during the day. It's as if the brain is unable to discern between when it's awake and when it is asleep. So a patient with narcolepsy may have a sense of overwhelming sleepiness sort of out of nowhere in the middle of the day. And the other main feature of narcolepsy is this very strange symptom called cataplexy, in which patients may experience muscle weakness, either on a more global scale or affecting specific muscles. And that's generally brought on by strong emotion, as I said, laughter, crying, and that sort of thing. The symptoms of what we'll call COVID-somnia can be myriad. Those patients may have some sleepiness during the day, like narcoleptics, or they may have some insomnia at night, an inability to maintain sleep or an inability to achieve sleep. They may have certain problems with their scheduling, as I said. Their internal circadian clock may not be aligned the way it should be. And one of the other problems that we're seeing with these patients is, sort of the misuse of sleeping pills or sleeping agents, we'll call them, prescription or otherwise. So this has also become a problem in this COVID environment.
So when should a person see their doctor, and what should they ask their doctor if they suspect they have either of these two conditions?
Well, certainly, a patient with narcolepsy, if they're experiencing, if they suspect that they may have narcolepsy, if they're experiencing, again, significant sleepiness during the day, which is really out of the ordinary, than just sort of, feeling sleepy after lunch, that kind of thing. It really affects really a more serious degree of sleepiness where it's affecting daily functioning, whether at work or interpersonal relationships, that sort of thing. And certainly if there's any sense that they may have this symptom of cataplexy where there's muscle weakness, again, it can be on a more generalized basis where many muscles can be involved, or just focally, just very specific muscles, that would be something to also address. It's a difficult diagnosis to make because there can be some overlap with other disorders. You can imagine patients with those kinds of symptoms may be misdiagnosed as having a stroke or a seizure or a fainting spell. And in fact, the diagnosis often takes many years to confirm because of these overlapping symptoms. And certainly, it's important for people with COVID-somnia to see their physician, again, if they're having significant sleep disturbance at night, because there's very good data that sleep disturbance obviously leads to a state of sleep deprivation, which can affect the immune system in its own right and make you more susceptible to the infection that you're concerned about.
And wow, this was really interesting information. Thank you. It's going to help a lot of our viewers. And I want to thank you, Dr. Simon, for coming on. We look forward to seeing you again soon.
Again, I appreciate the time that you've given me. And I would like to mention that at Avadel Pharmaceuticals, we're actually developing a medication for narcolepsy. It's an improvement on a certain medication that's already available. It's a standard of care therapy called sodium oxybate, which is very effective in treating the two prime symptoms of narcolepsy, that is excessive sleepiness during the day and cataplexy. But unfortunately, the current version of that medication requires the patient to actually get up in the middle of the night and take the medication. So we've developed a different medication where it's an extended release, controlled release type medication, which will allow the patient to just take it before they go to bed and not wake up in the middle of the night.
Well, we'll look forward to following that research then.
Thank you.
Okay, well, you take care.
Okay, appreciate it.
Bye-bye.